We see in your story the dilemma that faces healthcare professionals now, especially healthcare professionals in your situation. First of all, how are you feeling? How is the pregnancy going? And does April 22nd seem still on track for delivery?
Thanks, Lawrence, for having me and for your kind and thoughtful questions. Everything has been so far so good. We're looking forward to delivery, hoping that our little baby boy stays in there a little while longer. That's been the easy part these days. Unfortunately, the rest of the world seems to be burning down around us.
And what do you expect to be the situation for delivery of babies generally in the Boston area by the time you get to April 22nd, when the hospitals could be more overwhelmed with coronavirus patients?
Absolutely. I think, unfortunately, in the preceding segment, hearing about what's going on in New York feels like some kind of awful time travel to the future, giving us a sense for what it might soon be like in Boston. We're already seeing increasing numbers of patients and acuity of patients. Right now, they're still allowing single visitors to the labor floor. So my husband still gets a pass, but there's a very real chance that by the time I'm delivering in 4 weeks, there will be no visitors permitted in the hospital, which I know is the case in a lot of New York hospitals. And if that's the case, then that's what we have to do to try to keep everybody safe.
And of course, you've been training for birth and your husband's been training for birth with you. And by when the day comes, he might not be allowed in that room.
Yeah, it's something we never could have imagined 9 months ago when we were so happy to find out we were going to be starting our family. But we have to roll with the punches here and try to follow all the directions that the hospitals and administrators are putting in place to try to keep everybody safe.
Doctor, I'm sure you know other tough decisions made by other people. And in fact, in my view, every doctor who goes to work now in these hospitals every day is making what I think is a difficult decision every day to go to work and to be exposed to this. Tell us what it's like for the medical professionals who continue to go to work today, just as they went to work 90 days ago before they had any of this on their minds.
I am so in awe and so grateful for all of my colleagues, every single person who works up the courage to go to work every day, whether it's, doctors, nurses, people who are cleaning the rooms, people who are making the hospital run. I was scared to go to work every day until I was reassigned, and I can't imagine how they continue to muster the strength to do that. It's scary, it's real, it's getting worse, and I cannot applaud them enough. I think none of us can, for really putting themselves in harm's way.